my name is Selena. I'm going to be your doctor today. I will just be performing a neurologic exam on you today. Before I begin, can you please confirm your name and date of birth for me?
My name is Kishore Mansukani. My nickname is Kenny. My date of birth is October 15, 1973.
Okay, nice to meet you, Mr. Kenny. How are you feeling today?
I'm good. How are you?
Doing well, doing well. So essentially the purpose of today's exam is just going to be testing some of the motor and sensory functions of your brain and your body. So I will just be performing a few exams, and as I'm going to be referring to my audience just to kind of let them know what exactly is being tested. So you don't have to worry about all of the big words. I'm just going to be testing your motor and sensory functions, okay?
Okay, that's
Is that okay with you?
Okay.
All right, so the first exam I want you to do is if you can just close your eyes. So please close your eyes. And I'm going to cover up this nostril, and I just want you to tell me what the smell of this is.
Alcohol wipes.
Yes, it is an alcohol wipe. All right, so keep your eyes closed, and I'm just going to test your other nostril as well. So keep your eyes closed. And what's the smell?
Some kind of marker.
It is a marker, yes. Yeah. Okay, so that tells me that cranial nerve 1, the olfactory nerve, is intact. I will now be moving on to the second cranial nerve, which is the optic nerve. So can you please open your eyes for me? All right, the next part of this exam, I'm just going to be testing your eyes. So I'm going to place this about 14 inches from you. So this is about 14 inches, and I just want you to read these numbers for me.
8, 3, 9, 2, 5.
Okay, and can you read this one?
4, 11, 10, 18, 15, 8.
Okay, so the visual acuity is 20 over 50 minus 1, and the pupil gauge, I would say, is about 3. So I would say about 3 millimeters. All right, the next part of my exam, I'm going to be testing your eyes. I'm just going to be testing another function of your eyes. So if you can just close your right eye, and I'm going to close my left eye and focus on my nose. So I want you to focus on my nose, and you're going to tell me when you see my finger. Don't look at the finger, just focus on my nose, but tell me when the finger comes into your field of view.
Now it's coming to view.
Now?
I
Okay.
can see it now.
All right, now I'm going to do it. I'm going to tell me again when you see it.
Now I see it.
Okay. All right, we're going to do the same thing on the other side. So now I just want you to cover your other eye and tell me when you see it. Focus on my nose.
Now I see it.
Okay. And still focus on my nose.
I see it now.
Okay, perfect. Thank you. You can uncover your eyes. The next part of the exam is this light exam. This is the pupillary light reflex. So I'm just testing to see if his pupillary constriction reflexes are up to par and are normal. So I'm just gonna check. I'm just gonna shine this into your eye. So just relax. Okay, and so the direct and consensual response for the right eye is intact, and the direct and consensual response for the left eye is intact. All right, so the next thing that I want to do is I'm just going to put my finger here, focus on my finger as it's coming in, okay? Okay, perfect. So that tells me that the pupils are equal, round, and reactive to light and accommodation. The next part of the exam I will be doing is the corneal reflex. So I know this might seem a little bit painful. Don't worry, it's not. For my audience, this exam essentially tests cranial nerves 5 and 7. So what I'm going to be doing is I'm going to be just putting this in the cornea of your eye, and I'm just testing to see if the reflex is normal, okay? So just don't worry about it. Just look up if you can, look up, and just don't worry. I'm just gonna test and see if it's normal. Okay, perfect. All right, let me do the other side. Okay, perfect. Okay, so the corneal reflex is intact. So that tells me that his corneal reflex is intact. So now I'm going to be testing the cranial nerves 3, 4, and 6, so the ocular movements. So what I'm going to be doing is I'm going to be just testing your eye movements to see if your eye muscles are normal and intact. So if you can just follow my finger as I'm moving it. Okay. All right. So that tells me that his extraocular movements are intact. So the next part of the exam, I'm going to be testing more of cranial nerve 5. So for what I'm going to be doing is I'm going to just have you close your eyes, and I'm going to be basically putting this cotton swab on different parts of your face, and you're just going to kind of just tell me what part of the face this cotton swab is touching. So for example, if you don't feel it on your left forehead, tell me left forehead. If you feel it on your right cheek, tell me right cheek. If you feel it on your chin, tell me which part of your chin, okay? So just tell me where you feel it.
Left forehead.
Is that your left forehead or your right forehead?
Oh, sorry, right forehead.
Yes, okay. What about now?
Left cheek.
Okay, and what about now?
Right chin.
Okay, perfect. All right, so his sensory functions for cranial nerve 5, the trigeminal nerve, are intact. I already tested the corneal reflex, and now I'm going to test the muscles of mastication for the mandibular division. So what I want you to do now is I just want you to bite down. So every time you feel my fingers, bite down, okay? Bite down, relax. Bite down, relax. Bite down, relax. Bite down, relax. Okay, so the muscles of mastication are normal. So the next part of the exam I'm going to be testing is the cranial nerve 7, so I'm just looking for facial symmetry. So as upon inspection, I see that your face is pretty symmetrical. I'm going to have you do something, so if you can please smile for me. Okay, some smile is symmetrical. Can you please wrinkle your forehead? Thank you. Can you please can you please close your eyes for me? Okay, now what I'm going to do is I'm going to try and open up your eyes. You have to try and resist that. So don't let me open up your eyes, okay? Okay, perfect. And then can you puff out your cheeks? Yes, good. So you can open up your eyes now. And so basically I just want you to do puff out your cheeks. So kind of blow, just like you did just now. Like, okay, perfect. Thank you. All right, so the next exam I want to test is I want to just test your hearing. So what I'm going to do is I'm going to compress this ear, and I'm just going to do this, and I want you to tell me if you can hear it.
Yeah.
Okay. Now, I'm going to do the same thing for the other side. Tell me if you can hear it.
Yeah, I can hear it.
Okay, perfect. All right, so I just tested cranial nerve 7, the facial nerve. Everything was intact. He had facial symmetry, and all of the facial muscles, they were intact. The orbicularis oculi and everything was intact. So I'm going to test now. I'm going to test the cranial nerves 9 and 10. So what I will be doing for this is I would just like you to open your mouth and say ah. Okay, so the first thing I'm doing is just to make sure that the palate is elevated. Say ah. Okay, thank you. And the palate does elevate. Now I'm just going to be testing your gag reflex. I promise it's not going to hurt. I'm just going to put this in your mouth. I'm just going to see if your gag reflex is normal. So you might be gagged. Okay, thank you. All right. So the next part, so cranial nerves 9 and 10 were intact, the palate was elevated, and the gag reflex was normal. So the next thing I will be doing is I will be testing the cranial nerve 11, which is the accessory nerve. So if you can please, Mr. Kennedy, please bring your shoulders up like this. And what I'm going to be doing is I'm going to be pushing down. You cannot let me push down, okay? So you're going to try and resist that force, okay? So try and resist it as much as you can. Okay, perfect. All right, so that tells me that the trapezius muscle is intact. Now I'm going to do the same thing for one of your neck muscles, okay? So what I'm going to be doing is I'm going to be putting my hand on your face like this, and you're going to be pushing towards my hand, and my hand is going to be pushing on this side, okay? And you have to try and resist that force, okay? So I'm pushing this side, you're pushing this side, okay? All right. Okay, now same thing on the other side. Perfect. All right, so the next thing that I want you to do is I want you to I just need to test your tongue. So just want to see your tongue, and I just want to make sure everything is normal. So first, can you stick out your tongue for me? Okay, can you lift your tongue to the roof of your mouth? Like this? Okay, I just want to see it, make sure it's normal. Okay, and the next thing I want you to do is I want you to kind of protrude your tongue to the side of your cheek, like this. Okay, and I'm going to try and push it in, and you're resisting my force. So try and resist my force. Okay, now do that on the other side. Okay, perfect. All right, now stick out your tongue again, and bring it to the right and to the left. Yeah, and keep going. Okay, perfect. Thank you. All right, so that concludes our cranial nerve exam. I tested all 12 cranial nerves, starting from 1 all the way through 12, and all of the cranial nerves were intact, with the pupils being equal, round, and reactive to light and accommodation, and the extraocular muscles were also intact, and all of the reflexes pertaining to the cranial nerves were intact as well. So thank you. Then we're going to move on to the next part of the exam now. Okay, so the next part of the exam, I will be testing some of your muscles, so your muscle tone and your muscle strength. So basically, just what I want you to do is just follow my commands, and essentially what you're trying to do at each point, I'm going to give you more instructions, but you're just trying to resist my force. So if I'm pushing one way, you're trying to resist the other way, just so we can see if your muscles are intact and if everything is good, okay?
Okay.
So the first thing that I would like to do is I would like for you to do like this. Right. I'm going to try and push down. Remember, as I'm trying to push down, you're resisting my force. Don't let me push down, okay? So, okay. All right, so that tests the deltoid muscle, and it is innervated by the axillary nerve, both of which are intact, okay? So the next thing I want you to do is I want you to flex your arm. Doesn't matter which one. Yep, flex your arm. All right, and what I'm going to be doing is I'm going to try and push it in. Remember, as I'm pushing in, you're trying to push out. You're trying to resist the force, okay? Okay, good job. All right, and let's so do the same thing. I'm going to try and push it out. So keep your arm flexed, flex your muscles, and I'm going to try and push it out. You just resist that force, okay? All right, good job. All right, so both of those were innervated by the musculocutaneous and the triceps muscles, and both of those were intact, okay? So the next part of the exam is the flexion and extension of the wrists. So right now we tested the musculocutaneous and the radial nerve, both of which were intact. Now we are going to test the flexion and extension of the wrist. So what I want you to do is we call them the wrist flexors. Basically what I want you to do is just flex your wrist, and I'm going to try and push out. You're resisting that force, good job. And then I'm going to do the same thing, so extend your wrist like this, and I'm trying to push up, and you are resisting that force, which is good, okay? So the extension of the wrist was mediated by the radial nerve, and the flexion of the wrist was mediated by the median nerve, and both of those were intact. So the next thing that I would like to do is I would like for you to show out your fingers like this. And essentially, same thing, right? I'm just trying to see right here, as what I'm trying to look at is I just want to make sure that his ulnar nerve is intact. So what I want you to do is I just want you to kind of resist my force. So as I'm trying to push, I'm going to try and push them in. Don't let me push them in, okay? So here I'm testing to make sure that his fingers abduct and adduct correctly, okay? So abduction of the fingers is intact. Good job, thank you. And now what I want you to do is I want you to grab my finger, and I'm going to try and separate it, and I just want you to resist that force, okay? So, good job. All right, so adduction of the fingers is intact. All right, so the next thing I would like to do is I would have to do that with your hips. So what I'm going to do is at this point I'm testing hip abduction and adduction. So I want to see if his gluteus medius muscles and if his other muscles in his hips are intact, and if the nerves that innervate that are intact as well. So what I'm going to do is I'm just going to try and push out. And so you can put your hands to the side, but what I'm going to do is I'm going to try and push out. Remember, you're resisting the force, and you're not letting me push out, okay? So resist that force. I'm trying to push out. Good. All right. And the same thing, I'm going to try and push it in, and just don't let me push it in, okay? So as I'm pushing in, you're pushing out. Okay, good. All right, so that we did that. So the superior gluteal nerve and the obturator nerve, which innervate abduction of the hip and adduction of the hip respectively, are both intact. So the next thing, what we are going to do is we are going to see your toes. So if you don't mind, can you take your shoes and socks off for me, please, or your slippers? And what I want to do is I just want to make sure that you're able to kind of flex and extend your toes correctly, okay? So same thing, I'm gonna flex your toes, and I want you to, perfect, resist that force. Same thing on the other side. Okay, good job. Now I'm gonna do the same thing. I just want to extend. I'm gonna try and resist it. I'm gonna try and push it this way, push it out. You're gonna try and resist it. Okay, do the other side. Perfect. All right. So that tells me that dorsiflexion and plantar flexion are intact as well. So now I'm just going to move on to the deep tendon reflexes. So the next part of the exam is I'm just going to be testing some of your reflexes, okay? So this might hurt. It might hurt, but I promise you it won't hurt as much. So what I'm just going to do is I'm going to go to a few spots, and I'm just going to kind of hit this against, and it will trigger a reflex, and we're just trying to make sure that all of your reflexes are normal. So I'm going to start with the reflexes here. So just as soon as it hits, just relax your muscles, relax everything. So relax this muscle, relax. Yes, relax. Okay. And as soon as I hit this, we're just going to make sure his deep tendon reflexes are intact. So we're just going to make sure everything's normal. Okay. All right, I'm going to do that on the other side as well. Relax. 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 All right, just want you to relax. Don't stress. Just relax. Relax everything. Just take all of that weight and just relax. Relax this muscle. It's not relaxed. Yes, thank you. Okay, so I have tested his deep tendon reflexes, both of which are normal. So I would give that a 2+. And as far as the previous exam goes with the muscle tone and the muscle testing, all of those would be a grade 5 out of 5 for strength. So everything was normal as far as that's concerned. And these particular reflexes for the brachial, the brachial region, those were intact as well. All right, so the next thing I'm going to do is I'm just going to do the brachialis right here. So same thing, relax. Okay. Relax. Okay. So I would also give that a 2+ rating. All right, the next thing I would like for you to do is I'm just going to hold onto your hand like this. I'm doing the triceps now, so I'm just going to hold onto your hand like this. So relax this muscle. Don't contract any. Just let it drop. Let it hang. I'm looking for his tendon or his ligament, and I'm just going to see if his triceps are good. So again, just relax. Relax this muscle right here. This muscle's not relaxed. Thank you. Yep, thank you. All right. All right, that was a 2+ rating as well. Do the same thing in here, relax, let all of the weight go, yep. And just gonna do the same thing on this side. Okay. All right, now I'm just gonna do the same thing with the knees. So if you don't mind, just lifting up your, all right, perfect. So I'm just going to feel for this. Relax your legs, thank you. 1 second. All right, 1, 2, 3. Okay, it's a bit diminished here. Okay, yeah, so for the patellar deep tendon reflex, I would give the grading 1+ because it is a bit diminished. I'm gonna try the same on the left knee and see if it's the same. Relax. Okay. All right, so I would give that a 1+. All right, so the next I would like to do is I would like to test your Achilles reflex. So what I'm testing is his Achilles reflex. I'm just gonna do the same thing. I'm just gonna see if it's normal. All right, can I do the other one? Mm-hmm. All right, thank you. All right. Okay, so that concludes our deep tendon reflex testing. The next thing I want to do is I'm going to grab my stick just so I can see the Babinski test. So what I want to do is I want to test for the, so I want to just basically test for his foot just to see if that is normal as well. So for my audience, I'm just testing the Babinski reflex. All right, so let's just see if it is normal. Okay, all right. Okay, all right, so the Babinski reflex is absent bilaterally. So that means that, you know, that is normal, so that is good. The Babinski reflex is absent bilaterally, and all of the reflexes, I graded them as I was going through them. The patellar reflex for the deep tendon reflex was a bit diminished, but that was the deep tendon reflexes. So the next part of the exam would be, I'm just going to test your sensory functions on your arms and your legs. So what I'm going to do is I'm just going to do a little bit of light touch. So again, you're just going to close your eyes. I'm going to ask you where on your foot you're feeling it. So whether it's your toe, if it's your heel, if it's your if it's just like in the middle of your toe, just kind of describe to me where exactly you're feeling it, or if you're feeling it at all. If it's at the bottom of your toe, do you understand? Mm-hmm. Okay. All right, so I'm just going to test that now. I'm going to take my little cotton, so you can just bring your leg up. So I'm just going to have you close your eyes. All right, and let me know if you feel it. Do you feel that?
Yeah.
Where do you feel it?
On my, the toe.
Your toe, so the big toe?
Big toe.
Okay, and on what leg?
On the left leg.
Okay. Do you feel this? Close your eyes.
Yes.
Where is that?
At the bottom of the toe.
Okay. What about this? Where is this?
This is on the top of the toe.
Okay. All right. I'm gonna test it on this side as well. So just let me know again. Where do you feel it?
Top of the toe on the right leg. Top. This is the toe on the right leg.
Okay, and is it at the top or the bottom?
In the bottom.
Okay, cool. Mm-hmm. All right, and then keep your eyes closed. Mm-hmm. Tell me where exactly you're feeling it.
On my top of the left hand. Okay.
All right, and then other side.
Top of the right hand.
Okay. All right. So that means that light touch is intact. The next thing that I would like to do is I would just like to do a little thing, what we call the pinprick, okay? It's supposed to, I'm just testing to make sure that you're sensitive to pain. So it doesn't hurt, just look, it doesn't really hurt. But essentially what I want you to do is close your eyes. Again, same principle. I'm just asking you where you feel it, and if you feel it, just let me know where, okay?
Okay.
All right, so close your eyes. All right, tell me where you're feeling that. Or if you feel it.
Top of the left toe.
Okay.
Bottom of the left toe.
Okay. Give me the other one.
Top of the right toe. Bottom of the right toe.
Okay.
It's on the left hand.
Okay.
Left hand on the palm.
Yes.
Right hand on the top.
Okay, perfect. All right. So the next thing that we are going to do is I'm just going to take this. You can open your eyes and take this. It's called a tuning fork. Essentially, what it is it's testing your vibration. So I'm just gonna hit it and I'm gonna put it in your legs and your arms. You're gonna tell me if you feel it, and if you do feel it, tell me where. Okay.
Okay.
All right. So just close your eyes. Do you feel that?
Yes.
Where do you feel it?
On the left hand.
Okay, where?
On the middle.
On your arm?
On the arm,
Okay.
yeah.
Okay. All right. You feel that?
Yes, on the right hand.
Okay.
Yeah.
What about here?
On the top of the right hand.
Okay.
On the right hand.
Okay. All right. You feel that?
Yeah, on the left foot.
Okay.
On the top.
And then what about here?
Right foot on it.
Right here?
Yeah, right foot on the side.
Okay. All right. Perfect. All right. Good job. All right. So that makes me, so his sensation is intact to light, pain, and vibration. The next thing that I will be doing is I will be asking you to close your eyes, and I'm gonna touch you in 2 areas, and I want you to tell me if you can feel it. And if you do feel it, tell me where, okay? All right. Where did I just touch you?
On my right cheek.
On your right cheek and?
On the left hand.
Okay, perfect. All right, so tactile localization is normal. All right, so the next thing I'm going to go get is an object. So I just want you to keep your eyes closed, and I'm going to put this object in your hand, and I want you to tell me what it is.
It's a pen.
Okay, yes, it is a pen. Now keep your eyes closed, and I'm going to write something in your hand. It's going to be a number, and I want you to tell me what number you feel that I'm writing, okay?
3.
3, yes, that was a number 3. Okay, perfect. All right, so that means that his that stereognosis and his graphesthesia is also intact and normal. So the next part is what we are going to be doing is cerebellar function. So at this point, I'm just trying to test and make sure that your balance and your sense of your sense of balance and proprioception, which is basically just your sensations when you're walking and when you're balancing. So I want to make sure that those are normal, okay? So what I'm going to do is I'm going to ask you to touch my finger and then touch your nose, and then touch my finger and then touch your nose, and do that quickly, okay? So let's do a practice round. Yes, now keep going. Now do it quickly. Okay, cool. Good job. All right, the next thing I want you to do is I want you to lay out your hand like this, and I want you to go like this, and then go like this. Go like this, go like this, and just do that quickly. And here we are testing for rapid alternating movements. We are testing for to make sure that the patient does not have dysdiadokinesia or ataxia or anything of that sort. So we're just making sure that his rapid alternating movements are normal, and they are, okay? So good job. The next thing I would like for you to do is I would like for you to take your heel, so this part of your leg, and essentially what you're doing is you're taking it and you're going up like this. So if you can, so I'm just going to show you. It's okay if you can do it. So you're just gonna go up like this. So this is what we call the heel to chin test. So if you can do that, and do it quickly. Okay, perfect. All right. All right, so that means, okay, so that means so your rapid alternating movements are normal. The next part of the exam, I would like for you to stand up. All right, and can you close your eyes? And just stand there for 30 seconds. All right, put out your hands like this in front of you and keep your eyes closed. And I'm going to move your hand and you're going to try and put it back in the same spot. Okay. 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 All right, cool. You can open your eyes now. So that means that the Romberg test is negative. That means that basically what I just wanted to test was his posterior columns and his perception, proprioception rather. So that is normal and intact. So the next thing that I would like to do is I would like to test the way you walk. So what we call it is a gait. So I would like to test his gait. So I'm going to just pause this and I'm going to come right back to the next video just so I can show you guys his gait and we can practice for that. All right, so we are on the last part of the exam now. We are testing cerebellar function, and more specifically, we are examining the patient's gait. So, sir, what I want you to do is I just want you to walk normally. It doesn't have to be many steps, just walk normally. Yeah, just walk normally, like how you normally do. Yep, just walk normally. All right, cool, thank you. All right, the next thing that I would like for you to do is I would like for you to walk with your heels. So kind of walk walk on your heels. Thank you. And just take a few steps. It doesn't have to be much. All right, perfect. And okay, that's good enough. Thank you. Can you walk on your toes for me? Yep, on your tippy toes. Walk like a ballerina. There you go. All right. Perfect. Keep walking on your tippy toes. Thank you. All right, you can stand. And what I want you to do now is I want you to walk from heel to toe. So you're walking like this, heel to toe, heel to toe. And I just want you to do that for a few steps. So yeah, you can, there you go. So, okay, so what we're doing is heel to toe. So put your foot in front of you like this, and right in front of you, put the heel. Okay, perfect. All right. So that concludes the gait examination. The patient's gait was normal. There is no ataxia, and all of the gaits, the tandem gait, the heel gait, and the toe gait were intact. So all of those were intact and normal.